Okay, so some insights and takeaways from from reactive attachment disorder, so you can see the criteria, what it looks like, and how the child will express it. Um, the one thing that in terms of a place to start and like, okay, like how do we get our heads around reactive attachment disorder high level is that it's it's not the inability to attach across the board with anybody. It's really the what they use, the underdevelopment or lack of attachment connection to people in their lives, who are supposed to be their caregivers, their care providers, what they call putative caregiving adults. Um, by the way, if you don't know, because clearly someone was like using their like Word Genius app when they were writing this, putative means um, considered to be or reputed to be. So just in case you weren't sure, because I had to double check. So anyway, yeah. So they may attach to other people in their lives, and it was interesting when I was rereading this was that having my very first formal job in a formal paying job, well, I actually started as an internship in behavioral health at Shepherd Pratt as a mental health worker in a town in Leslin Ward, now over 30 years ago, um, that I saw that firsthand. Um, because even though this was an inpatient unit, at least in those days, those children were often there for a very long time. By that I mean months, and sometimes many months. And yeah, when the people who work there, the nurses, the mental health workers, who saw them every day, might form very strong bonds with them. And it can be a challenge because you've got to, that's a it's still a worker client relationship, um, but these children can reach out to you in a very parental way, and it can be hard to like not feel the urge to respond in a more parental way. um, and in some ways, it's a longer discussion. In some ways, you can respond in a parental like way in terms of like, here are the rules, here are the boundaries, and this is, what happens, in trying to offer consistent boundaries. But the point of all that being is that they can form attachments. It's just they're selective and often rejecting of the people who are air quotes supposed to be um, the people they're attaching to. And when we talk about social neglect and other forms of neglect and sadly even abuse, we understand why oftentimes. So in other words, that reactive attachment disorder, the behavior that's described in the criteria may be very understandable in terms of the social circumstances that child is involved in. Not always. Certainly, sometimes there can be, and I think this is part of the point of why we call it, a diagnosis and the disorder, is that that neglect may be or abuse may be absent, but there's still the reactive attachment disorder or the presentation thereof. I will tell you, just in my own experience, that there's always a connection back to social circumstance. In other words, there's never been, again, just in my own travels, so you take it as you will, where a child's presented with a reactive attachment disorder and you learn of their social circumstances as a worker, and you're like, okay, yeah, I think I get where this is coming from. So there's that. Um, So some other hallmarks of reactive attachment disorder, often diminished or absent expression, particularly regarding positive emotions, things that would be you would see as to be expected and normal for a young person, child. Um, and this is particularly during it can be more broadly, but it's particularly in those actions with those caregivers, those reputed caregivers that they're not attaching to. Um, and it's important about the diminished or absent expression of positive emotions because that can be misinterpreted as other things. So making sure that you're looking at the totality of the criteria versus the presentation that you're observing and the other data that you may have, in addition to, like, as best you can, trying to tease out the social circumstances. Emotional regulation capacity is compromised, display episodes of fear, sadness, irritability. For usually the social circumstances is, again, my interpretation of it. The social circumstances that are most commonly attached to reactive attachment disorder are such that a child feels, and this is the best way I can describe it, if a child feels like the ground beneath their feet is not steady, reliable, that because of social circumstances, including abuse and neglect, that they just don't feel sort of steady, like there's a solid ground around them, that things, meaning that things can shift in their lives very, very quickly. It can create a sense of just being very unsettled. And of course, at a young, at a child's age, when they're still, very much just beginning to develop their brain, it's hard to be able to express that, in a clear way. And so a lot of times that expression comes out in what looks like, mood lability and overreaction to circumstances, emotional over and behavioral and emotional overreaction to circumstances. And again, that's why just looking at gathering the data as we talk about, and really looking at data to criteria, um, is going to help you not misinterpret what you're seeing, because there's, again, when you read these, some of these about the presentation, these things can get misconstrued as something else. Um, just to wrap this up, in terms of the age, the child must have a developmental age of at least 9 months. Again, not chronological. We're talking mostly chronological, but if there's evidence of developmental delay of some sort, that's also important to take into consideration if you have that data, or you believe you're observing that, to factor into your diagnostics. Um, Serious social neglect is a requirement. So, let me, I might have not said this clearly as I'm thinking, earlier in this video. So, by the criteria, serious, what they call, this is the DSM's term, serious social neglect is a diagnostic requirement. So what they're saying is that, that if there's not the social circumstance to attribute it to, and this is my interpretation of it, then it's not reactive attachment disorder. So in other words, these symptoms don't present. Let me just make sure I'm clear about this. These symptoms, according to DSM, do not manifest. If they manifest without the social connection, the social neglect, and social, what to use, obvious social circumstance connection, then it's probably something else diagnostically. Um, and and this is something that is, again, from a developmental as well as chronological concept. This is a diagnosis that you would, if they're younger than 9 months, older than 5 years, you probably, the guidance is to look elsewhere diagnostically. Okay, so that is the summary of reactive attachment disorder in terms of some what I would submit to you are the key takeaways when you read through the text. Okay.